Thank you, Solange, for the presentation, and thank you everyone for joining. I would just like to ask Solange if you could make us the presenters so we can show our slides, please.
You are already presenter.
Oh, okay. Sorry for that.
Okay.
So everyone can see the slide, I guess, now?
Not yet.
Not yet.
Not yet.
You might need to invite me one more time to be the presenter.
Can you disconnect from being presenter?
Okay, just okay. Should work now.
Okay, it is working now. I can see your screen.
Okay, perfect. Thank you. Thank you so much. So thank you again, and welcome to the webinar. It's really a privilege to be part of this series. We'd like first to thank Cochrane South Africa, Solange and the team for having us. We would also like to thank Dr. Tamara Lutfi for connecting us from the Global Evidence Synthesis Initiative, GESI. And we would also like to acknowledge our colleague, Rasha Fadlallah, who's contributed to this work. So today, Amina and myself are going to present on the topic of priority setting for systematic reviews. We would like to acknowledge our conflict of interest, which has been mainly our work in this field. We've done a systematic review on the topic, which we would cover in our slides. We've developed the tool called Spark tool for priority setting, and we've done different number of projects in this field. Okay, so what we're going to cover today, we're going to start with our learning objectives, cover some key concepts, then go to the more practical part. So cover the steps of priority setting for systematic review. So this is if in your setting you decide to conduct a priority setting exercise, what are the different steps that you should follow? And then we would cover a particularly important part of this process, which is the criteria to be used in setting priorities. We'll go into details, and we'll cover very briefly the Spark tool. As Solange mentioned, we are very happy for anyone to ask questions as we go through the slides. So please feel free to type in your question. We'll try to keep our eyes on the chat window. So starting with the learning objectives, so again, hopefully we can help everyone become, I guess, more familiar with the different steps to follow when conducting a priority setting exercise, specifically for systematic review. And we say systematic reviews because priority setting could be done for primary research, and there's a lot of literature on that, for systematic reviews, and for projects such as guideline projects. And the second objective, as mentioned earlier, is to learn more about the different criteria used. So let's start with covering some key concepts of priority setting. There are a number of definitions in the literature. So this is the one by the Alliance for Health Policy and Systems Research at WHO. It's a program to generate consensus about a core set of research issues that urgently require attention in order to facilitate policy development. So I would like to draw your attention to the concept of consensus. So consensus is actually one way to do this, but it's the most commonly used way that eventually different stakeholders have to agree on what are the priorities. And then this definition mentions the word urgently, and as you will see, urgency is one of the criteria used for setting priorities. So we already have some of these criteria emerging in this definition. But what is most important, I think, is the last part, which is to facilitate policy development. So any priority setting is linked to a certain objective, which is policy development, conducting systematic review, conducting research, etc. So that has to be kept in mind as we go forward. That's another definition that says it's a notional approach to find out what to regard as more important or less important in healthcare. So there's the concept of importance. It primarily means to bring aspects into a ranking order. So this definition focuses on the output being a ranked list of priorities. You have to keep in mind that most of the time this is true. We have a list of 10 potential topics. We have the capacity to conduct 3 systematic reviews. So we come up with a ranked list and we go with the top 3. So that's one approach. In some other cases, it's a question of yes or no. Is this question a priority? Should I update the systematic review? So there's no ranking. I just have to make a judgment about that specific systematic review. So in this case, the ranking order does not apply. So if I could just have a sense from participants, in your case, is approach, or let's call it a yes-no approach. Could you just type in very briefly what case you deal with? So if you could just let us know whether in your case, or maybe I should ask first the question, do you have to deal with priority setting in real life? Is it something that you deal with as opposed to attending today just because of interest? So just let me know whether priority setting is one of the tasks. Is it part of your job description?
And just to remind participants that you can respond by typing in the chat box or unmute yourself.
So, thank you. So I'm guessing this is a yes, that this is part of your job description. Okay, for the vast majority. Okay, good. Thank you. Thank you. Very helpful. Okay, so the next question. When you deal with priority setting, is it more of, let's call it a ranking approach? You have to rank a list of topics by the most important, or is it, let's call it a yes-no approach? Should I update the systematic review or not, for example? Okay, Bernard and Solange, yes, ranking, okay. Very good. Okay, so that's the case for the majority, I guess. Okay, thank you. So that's another definition. Priority setting can be defined as the ordering, so we go back to the ranking list of problems using notions of urgency and or importance in order to establish a preferential order for action. So we go back to the order, and then you can also see some kind of criteria popping up from this definition, the urgency and the importance. Okay, so why do we do priority setting? So what's the reason? So you're gonna find that most of these are obvious reasons, but you'll also see later on that many of these, if not all of them, use them as criteria. So first, it helps to optimize allocations of scarce resources. I guess all of us face this challenge, and when we talk about resources, it's not just financial resources, but in most of the cases, it's human resources. When you have limited expertise in conducting systematic reviews, you have to decide where to allocate that expertise. Conducting priority setting acknowledges the needs of policymakers and stakeholders. And this is important because what you want to produce in terms of systematic review has to respond to the needs of those who are supposed to use it. And then that would also increase the uptake and the buy-in. So conducting priority setting, which implicitly has to involve stakeholders and policymakers, will help achieve that goal. It maximizes the impact of research and helps avoid research waste. There's, as you might know today, there's a problem of what's called replication of research. where the same topic is explored again and again by the same study design addressing the same question. And this is very common in systematic review. I'm sure you've seen cases where there's a topic that has been covered by a number of systematic reviews. I can tell you from personal experience, last year we conducted a systematic reviews about the use of the defibrillator in patients with non-ischemic heart disease. So we finished the review and we got to the part of the discussion where we need to compare to similar reviews. And when we searched the literature, we identified 21 other systematic reviews actually published the same year. It just happened that a major trial came out and everyone rushed to publish a systematic review on the topic. So obviously that shows that we should have done a better job at reviewing the literature, at what has been published, or maybe checking Prospero on what is in the pipeline. But that is definitely an issue. So priority setting, as you will see, part of it is exploring what's out there in terms of systematic review to avoid research wastes. Importantly, it ensures health policy decision-making is based on the best available evidence. And we know that the best available evidence is presented in systematic reviews. So that's part of the advantage of doing priority setting. So we'll move now to getting more into the details of the steps of conducting priority setting. So Amina is going to take over, and she's going to start by briefly telling us how we came up with these steps.
Thank you, Dr. Eli, for the introduction and for letting us know about the importance of priority setting. We'll move now, as Dr. Eli mentioned, to the steps of priority setting for systematic reviews. And actually, this work is based on a recent systematic review of the literature that we've conducted here at AUB to look at existing approaches and priority setting exercises in the literature. And based on the findings of the review, we've identified the 21 peer-reviewed articles that reported on 19 studies. Among these studies, there were four priority setting approaches that were proposed, 12 conducted prioritization exercises, and 3 studies reported on both proposed approaches and conducted exercises. The health areas that were addressed in these papers were clinical practice in 9 of the papers, public health priority setting in only 1 of the papers, health policy and systems research in 3 of the papers, and 6 of the papers covered more than 1 field. Based on this review, we've tried to synthesize the literature to identify the steps that need to be followed and the criteria that can be used while setting priorities for systematic reviews. We've divided the steps into 3 different stages. Pre-prioritization, so what should be done before doing the actual priority setting exercise, and then the conducted exercise, and following prioritization, post-prioritization, how to follow up and after doing this work. So if you can briefly mention to us, what do you think are the different steps that have to be conducted before doing the actual exercise? Just type in any of the steps that you think are important before doing the actual exercise. Okay. So one of the mentioned steps is reviewing existing priorities or problems, and this is a significant step. Searching the literature, this is excellent. Thank you, Hazel. So consulting with key informants, thank you, Philo, this is excellent. And we'll now check if consulting key informants is done pre or during prioritization. Maybe we want to specify that before prioritization, we identify key informants in order to involve them in the exercise. So many of the answers are focusing on stakeholder involvement, and we'll see where in the different phases this comes. Okay. So we found in the literature that during the pre-phase, we have to set the rules and the different guiding ethical principles that will direct this exercise. For example, transparency, public accountability, in order to ensure that the exercise is conducted in a transparent and ethical way. And then we move into the generation of initial list of topics. And this is very important because we want to determine based on which topics the exercise will be conducted. Can you let us know what are different ways or methods to generate the initial list of topics that will be used in the exercise? So what do you think are ways of doing that? Or maybe how do you do it in your priority setting exercises? Thank you, Solange. So survey is one of the ways to generate the initial list. Excellent. So brainstorming ideas with peers as well as engaging stakeholders. Comparing literature, as Nabila mentioned, using the Delphi tool, excellent. Mapping the knowledge, and we'll see how can we map existing evidence. So different ways of looking at the initial list or generating the initial list are, as you all mentioned, reviewing the literature. And here we look at the primary studies, existing guidelines, existing systematic reviews to identify what are the topics that are mostly researched in the area of interest. We go to the health information system in order to identify topics that are of priority concern to the national health system and policymakers. And if we've conducted any previous priority setting exercises, we want to make sure that we're building on the previous exercise, as well as consulting with stakeholders. So now we've generated the initial list of topics. We want to look at the technical or epidemiological data that are relevant to this list in order to have an idea about the burden of disease for the different topics, the magnitude of the problems, the mortality and morbidity data. As well as analyzing research gaps. So now that we have the list, we want to check where are the gaps in order to have a sense of where the priority topics might exist. Now we move into the actual priority setting exercise. So as you can see, there are three major steps that are the use of established methods. So are you aware of any priority setting tools that can be used or adopted in a priority setting exercise? Or have you used any? For example, you've mentioned expert opinion, which can be incorporated in one of the tools, or use the Delphi technique in order to build consensus in an existing method. Other methods include, so to assist you in available methods, for example, there is the Spark tool that we'll introduce later in the presentation. There is the James Lind Alliance methodology for prioritization. So these tools can help in building the exercise. Next is the involvement of stakeholders during prioritization of the topics. What are different, in your opinion, what are different types of stakeholders that can be engaged in the ranking or the prioritization of the topics? Who do you want to ensure is contributing to the exercise? So a lot of focus on policymakers as well as the health professionals in the field. We also want to ensure that the sponsors or the research funders are part of the exercise. The scientific committee as well. So another question to you, excellent input from Solange, which is the involvement of patients and the public, because they are the end users of the health services. And we want to make sure that the research is aligned with their priorities. Next, we move to the different types of stakeholders that we've identified. So many of these you've mentioned already, including the policymakers, the healthcare providers, researchers in the field, members of the public, patients and their representatives, health system payers and research funders, as well as product makers and the industry, and the press and media organizations. So while looking at the different types of stakeholders, we had a discussion about whether to include the systematic review team who's conducting the exercise as one of the stakeholders. And we'd like to get your input on that. Do you think they are one type of stakeholders, or they're just the leading team on their work? So true, the systematic reviewers are researchers, but in this specific category, we're referring to researchers in the field. They are clinical and health professional experts. They don't have to be systematic reviewers. So there is really a debate whether to include systematic reviewers conducting the exercise as one of the stakeholders or not. I just wanted to clarify that product makers and industry, there is controversy on whether to include them as stakeholders in the exercise. So in the prioritization, we also use the criteria in order to rank or order the different topics that have been generated and discussed with the stakeholders. We move now to the post-prioritization phase. So now we've identified the priority topics. First, we want to make sure that the topics are defined into review questions following, for example, the PICO format. We might analyze research gaps in order to identify from the priority topics which are the ones that will move forward with in terms of dissemination and implementation. We want to make sure that we have a monitoring and evaluation plan in order to assess the priority setting exercise and what were the key success factors in the exercise and things to improve, as well as the appeal and revision mechanisms. So do you have any questions or clarifications regarding the steps of priority setting for systematic reviews? Okay, we move now to the priority setting criteria with Dr. Eddie.
Okay, thanks, Amina. So as you've seen with the steps, there are different steps, and in the prioritization phase, we need to use criteria to select or to rank the priorities. So we'll cover these, and again, this is an exhaustive list of criteria. What we did, as Amina mentioned earlier, we identified a large number of approaches that have been proposed, many prioritization setting exercises. So we went through them and collected all the criteria that have been used. And we mapped them and tried to put them together in different categories. So you can see the categories and we'll go over them one by one. So we start with problem-related considerations. So with this one, it's mainly about what does it mean to have the problem. So it's problem-related. So the public health burden, so this could relate to morbidity, mortality, prevalence of the disease. The economic burden, so this is typically correlated with public health burden, but you could think about cases where maybe it's not a prevalence disease, but the economic burden is huge. The burden on the healthcare system, meaning how much services are being consumed by the problem. And then equity consideration, is the epidemiology of the problem affecting more those who are disadvantaged and vulnerable populations as opposed to other populations. So you can tell that this is mostly focused on the problem. Then there's the practice. So putting aside the problem, the practice of, let's say, physicians. When there's uncertainty for decision makers or practitioners, so there's evidence out there, but they're still unsure what to do. Do we recommend this medication or not? This is a good case where it would be helpful to systematically review the evidence. Sometimes there's not uncertainty, but there's variation in practice. And it would be important to conduct a fresh, well-done systematic review just to draw the attention to where the evidence is pointing. And that could, in some case, at least that's the assumption, help with minimizing the variation in practice. So again, in terms of practice, it's either the uncertainty or the variation in practice. We move now to existing systematic reviews. So there might be a problem that is prevalent, there might be variation in practice, but when you go out there, there is already available systematic review, and that's similar to the case I mentioned earlier. So one of the criteria are the systematic review available, but that's not enough. So there might be a systematic review out there. The next question you should ask, is the systematic review that is available out there of good quality? Because even if there's 20 systematic reviews, if none of them is of good quality, that's a criterion for you to go ahead and move forward with prioritizing the topic. Similarly, the relevance of available systematic review. So if there's a systematic review done about, let's say, kangaroo patient care, and it's focused on high-income country, you say, you know what, I'm in a different setting, and I do need to know what the evidence in middle-income or low-income setting look like. So, and it's not that there is no systematic review, it's just that the available systematic review is not relevant to our practice. So this is when you go and do your systematic review or prioritize it. And then the currency of the available systematic review. So you might identify a systematic review, it might be of high quality, it might be relevant to you, but it's simply outdated. So you still go ahead and do it. So these are the criteria relating to existing systematic reviews. And I can tell you that we use a similar approach when we develop guidelines. We look for systematic reviews to make sure they are good quality, they are relevant, they are current. If not, this is a reason to do a new systematic review. So now there are considerations related to practice. So are there availability of primary studies? So if we know somehow that there are no studies out there, and if we go through the exercise of doing systematic review, we'll end up with what's called empty systematic review. This is a reason not to do the systematic review. It's just going to be a waste of time. And then we have to think about the potential change to conclusions. So let's say there is a systematic review where the certainty of the evidence is already high. The message coming out of the systematic review is very clear. Let's say there's overwhelming benefits, minimal harm. So even if there's a new primary study, it's probably not worth conducting a new systematic review because of the assessment that the potential for change in the conclusion is very unlikely. Next, the question is amenable to review. So there are some questions that are not amenable to review. So these are questions that are vague, or maybe are about a practice that is not possible in our setting, or is not current, that was being conducted years ago, then it's probably not worth it. So the urgency came up earlier in the different criteria. So if there's, so the example of a new epidemic, so this happened years ago with the avian influenza, there's urgency, there's a potential for pandemic. Then there's a need to conduct a systematic review to identify whether certain antivirus helps. So this is definitely an indication for conducting a new systematic review. It happened with Zika virus, it happened with the Ebola virus, where there was urgency to conduct systematic reviews on the topic. And then we move to criteria related to implementation considerations. So we could conduct a systematic review, but we have to make sure that the findings are applicable. So whether we should conduct MRI for back pain, let's say MRIs are not available, then it's probably not a good idea. Okay, thank you. Then there's the capacity to implement the intervention, the availability of resources, and the political will. So sometimes, for some reason, there's no political will to implement the intervention. It's probably not a good idea to waste the resource and then find that the findings are not being implemented. Then we have the ethical and moral consideration. So these days you hear a lot about social responsibility. So this is coming from the corporate world. but this could also come from the systematic review team. So we've been in cases where there was a topic that was not being requested by stakeholders or others. So the topic was about the interactions between the pharmaceutical companies and physicians. So that was not actually driven by any demand by stakeholders. It was driven by what we felt was social responsibility, something that we should study and explore. So ethical concerns, whether we should do, so sometimes there are topics that are not ethical to do research on or conduct systematic reviews on. So this is the case, for example, of conversion in the case of people who are, so for example, men who have sex with men. So I've been in a situation where there was a question, should we conduct a systematic review about conversion in terms of gender, etc., or conversion in terms of behavior that was deemed unethical. And then moral obligation. So this is kind of related to what we've discussed so far. And then there's a set of criteria related to interest to the topic. So we ask, are health professionals interested? Are consumers interested? Are stakeholders at the national level interested? Regional and global stakeholders, and the systematic review itself. So the more interest by more groups there is, the more likely we would conduct the systematic review, the more likely we would prioritize those topics. And as systematic reviewers, I'm sure you can relate to the fact that the interest of your own team or your team members in a particular topic will make it more likely that you will conduct the systematic review. And then the expected impact of applying the evidence. So once we have the evidence published, do we expect it to impact health policy and practice, health outcomes, economic outcomes, patient experience of care, health systems, and equity? You can see it's already a long list of criteria. And the way we like to think about these criteria is really like a menu. So what we've done in our systematic review, we've made sure that all of these criteria, everything that has been listed in the literature is covered in our findings. And that's what I just did. I went through over all of them. But it's obvious that it's sometimes impossible to include all of these in your priority setting exercise in terms of criteria. So again, you think about this as a menu, and what is relevant to your setting or to your work, or maybe to the funder you are dealing with, to your context. And you might say, you know, I'm going to focus on maybe practice consideration, the existing of primary study, and existing systematic reviews. So I'm going to stop for a second. We've been talking for a while, and just ask whether you have any question about any of those topics, or I should call them criteria for prioritization. Is there any criterion that you did not expect, you were surprised with? Or are there any additional criteria that were not covered in this list? Do you use any other criteria? Have you thought about any other criteria? Okay, sounds like.
Hi, Ellie, it's Tamara here. Hi, can you hear me?
Yes.
Thank you for joining us today. I have a question more, not so much about the criteria, but the process of, so for example, if you're embarking on a priority setting process and you have various stakeholders in the room, say you're working with policymakers, would you agree what would be your process of agreeing which criteria they think are important in considering priorities? Or would you kind of come to them and say, well, we suggest, you know, you should focus on the burden of disease, or how have you gone about it in terms of the process?
of selecting the criteria.
Of selecting the criteria for a specific priority setting exercise.
Yes. So whenever we've done it, so the first time we did it, actually we did not have many criteria. So the first priority setting exercise we did was about maybe 5 or 6 years ago. And what happened at that time is that it was a slightly different process, and I explain, and you know, I could get your input. So we had in mind the topic of refugee health. So in our setting, refugee health was a big issue. So we were receiving a large number of Syrian refugees because of the conflict in Syria. About a third of the population was made up of refugees. So our Center for Systematic Review felt that, you know, we need to deal with that. We need to contribute to that crisis. So when we gathered the stakeholders, we chose them based on this topic, and we said, look, our topic is refugees, and we have to prioritize topics that are related to the health system, so we can conduct a systematic review and hopefully later use it for implementation. So it was a very wide range of, it was a broad topic, and then it was an open discussion. And at that point, we did not, you know, people actually used criteria they had in mind, things about the burden of the disease, things about the strain on the healthcare system, things related to the cost on the healthcare system. And then this is what happens. We did not have it in a structured way. And then they came up with a certain list of topics. And then as systematic reviewers, we took those topics, so it was a more defined list. And then we went and did our job in terms of looking what systematic reviews were published, whether there are studies potential to include, etc. So it was done in 2 phases. So criteria that were implicitly used by the stakeholders, they were not very explicit, to determine what is important for them from a systems perspective. And then as a systematic review team, we used the criteria that are more relevant to the technicalities, the technical aspects of conducting systematic reviews, which is existing systematic reviews, their quality, whether they are up to date, and whether there are existing studies.
Cool, thank you.
Thank you. Any other questions, or we would be interested in, for example, what are the criteria that you tend to use the most in your setting? Okay, so the burden of the disease, yes, so that's obviously a dominant one. So, Tamar, you say universal healthcare. Could you please, I'm interested in learning more about universal health coverage. How do you use that?
That's a good question. So I guess maybe looking around what we've been doing is looking around the thematic areas within universal health coverage, and then yeah, those are more the topics. That's more a topic than a criteria.
Yeah.
But I guess, yeah, in terms of once we do the first priority, get the first list of priorities, I guess then they can become criteria. You know, well, no, I'm mixing things up. Don't listen to me.
No, you know, let me tell you one thing. So this is what we realize that this is not simple. So, for example, when we look at the studies of priority setting, people had different starting points. So I can give you an example where people started with saying, okay, when I conduct a priority setting exercise for systematic reviews on non-communicable diseases. So they start with the topic, so that's a very broad topic, non-communicable diseases. And then, for example, they move to a more specific topic, which is, let's say, cancer. And then they move to the topic, okay, should we talk about screening for cancer or treatment of cancer? So then they move to the treatment of cancer. And if you notice, we are already 3 levels down and we don't have questions yet. So these are still topics. So treatment of cancer, are we talking about cancer under palliative care or cancer under active treatment? Now let's say it's palliative care. So are we talking about pharmacological treatment or are we talking about non-pharmacological treatment? And next you get to your PICO question. And different studies had different number of those steps, like how many steps they had to move forward to get to the specific PICO question. And this is something that there's no clear guidance in the literature of where you start. Do we start at when we invite the stakeholders, do we say, okay, NCDs, and let's work together on getting the specific PICO question, versus as a systematic review team, you have to do some work ahead and say, okay, you know what, apply some of these criteria yourself. But in our setting, the prevalence of the disease is really high with cancer. It's really, we have very high costs with treatment. So you start by saying, okay, let's talk about treatment of cancer patients. So where do you start is definitely an issue. Okay, and Lana, you say mostly what is significant to a particular research interest. So you're talking about the research of who exactly?
We in occupational therapy, we are still very much developing our, and I'm working a lot with postgraduate students, doctoral and master students. So very often a systematic review will be something that's done as part of a bigger research project. And then, yeah, that is how we then prioritize.
Yes, so in this case, I guess the main stakeholders are the researchers. So the purpose of the systematic review is to help researchers identify the gaps of what should be done next in terms of research, I guess.
Yes, yes.
Yeah, so that's definitely interesting. So see that for different, so defining who the stakeholders are is key, because that will guide the criteria based on which you would prioritize. Thank you, that's very helpful. Okay, so to move, I guess we've covered. So to go back and have a quick look, we've covered the key concepts. We talked about the steps of priority setting for systematic reviews. So steps is you have to think about it that this is kind of your protocol. What should I do in step number 1, step number 2, step number 3? And here also we will share with you the different tables. And this is kind of a roadmap that you could use. The criteria, as we've seen, it's a menu, and you have to think in your context what should be done. I've already, or Anna has already mentioned the SPARK tool, so we'll tell you very briefly about the SPARK tool and our experience. So in our center, SPARK, which is a center for conducting systematic review for health policy and systems, in collaboration with K2P Center, we've developed this approach for informing health policy. So it starts with priority setting. You could see that a key point is engaging stakeholders and taking into account the political context. So formal and informal discussion, and this is how we come up with the priority setting. Based on this, we choose the PICO question. We conduct our evidence synthesis, and then we move to knowledge translation. So this is in the different forms. You might be familiar with those: policy briefs, briefing notes, rapid response, evidence summary, meta bias. So we kind of make it more more oriented to the policymaker, and we move to the knowledge update. So in the case of the refugee problem I mentioned, we ended up prioritizing one question, which is about the coordination between agencies providing health services to refugees. So we identified a different number of approaches for coordination, because it became obvious with stakeholders that the NGOs, different organizations working on the field, were either doing the same work, overlapping work, while at the same time, some needs were not being addressed by any of them. Sorry for that. So we moved to do a policy dialogue, and all of those who were invited to the priority setting were invited back to the dialogue. And one of the outcomes was that the Ministry of Health started a position to coordinate health services between NGOs. So if you are interested, the Spark tool is just one tool. We'll be hopefully publishing our systematic review soon. You will see that there are other tools out there and different approaches. And there's a lot to learn from these different approaches. So the Spark tool is just one of them. If you are interested, it has specific criteria. What I will mention about the tool is that it has 2 modules for criteria. So we try to group the criteria into 2 big groups. One of them are those relevant to the stakeholders. So things around priority, the burden of the disease, the concern of the community, the cost, etc. So everything that is contextual, that could be judged by the policymakers and the stakeholders. And another module that is oriented towards the systematic reviews is more technical. It's about, is the question answerable? Are there available systematic reviews? If yes, are they relevant? Are they up to date? Are they high quality? Are there primary studies available, etc.? And the way we've used it, so to refer back to Tamara's first question, we do a first meeting with the stakeholders where we apply the questions that are contextual questions. And let's say we come up with a list of 10 relevant questions from the point of view of stakeholders. And then in a second and separate step, we put them through the module that is specific to systematic reviewers. It's a more technical that answers the questions I mentioned about availability of systematic reviews and primary studies. So we'll stop here with our slides. I guess we've talked more than we should have. And we'll be happy to take more questions or comments or even suggestions that you would, or maybe experiences that you would like to share.
So the floor is open. We've got 5 minutes until the end of the webinar. If anybody wants to ask any question or type any question for Ellie and Amina. Ellie, maybe I can ask you something. One of the criteria you mentioned was that if you know that a review is going to be empty, you shouldn't do it. There are people that say, though, that you won't really know unless you do a review, because that's when you do the proper searching of, the comprehensive searching to try to find any evidence on the question, and that it still informs your primary research about gaps where research needs to be conducted. What are your views on that?
Okay, I think I've got the question. So yes, I did, maybe I should have said it in a more specific way. So I probably would not prioritize it as opposed to not do it. And again, I think it depends on who the stakeholders are. So if the stakeholders are policymakers that are trying to address, the burden of the disease, trying to work on the SDGs, trying to improve the health system, they would be very disappointed if we say, okay, we're going to address this question, and then we come back to them and say there's no evidence. If you want to ensure evidence-informed decision-making, we should try to get them, or at least take them through a topic where there's evidence that could help them. Obviously, if the focus is on conducting new research, so in many settings, in order to do a study, you need to get funded for a study. You need to show that there's lack of evidence, so you can address that study. So it is important. So in that case, an empty review is the perfect outcome. So definitely in that case, you would do the systematic review and publish it and say there's nothing to answer this question. That's why we need to get the funding. That's why we need to do the study. So again, I think my impression is that it goes back to the audience, and the answer is an empty review might be the thing to do, depending on the audience.
Okay.
And then, you know, I think as I'm just reading here in the window, so Thilo mentions a good point, which is the scoping review. So scoping review is kind of showing where the gaps are. And one way scoping reviews are being used is that the topics where there's lots of primary studies, this is where you go and do a full evidence synthesis, and studies where there are, or questions where there are no studies published, primary studies published, this is when you prioritize for primary research. Okay, so going through the questions. Okay, so Nancy, must priority setting also be done before conducting a scoping review? Good question. I guess you could always prioritize. I would say yes. I haven't seen such an example, but you know, like any effort, if you're gonna spend time and resources and involve people in that project, there has to be some priority setting. So, you know, the extent to which the priority setting is sophisticated or detailed will also depend on how much time and resources you have.
Can you tell us if when you've used the Spark tool, how long does it take from pre-prioritization to having your final questions for the review?
So I can tell you that unfortunately we haven't used the Spark tool as such in a priority setting exercise. You know, we've developed it so we could use it for that purpose. It's just didn't happen. We did what we did in terms of priority setting before the Spark tool. And actually we did it because we felt that something was missing. We wanted to have, you know, a more structured process. But what we did before that was, you know, kind of, it's a process that we felt was a bit structured, but not as structured as it would have been with the Spark tool. And if I remember correctly, it's about, you know, 2 to 3 months. And it's mainly to, you know, prepare for the meeting, invite the stakeholders enough time ahead of that meeting to make sure that they attend, bring them together, conduct the meeting, and then synthesize the finding just after that meeting and share them back with the stakeholders.
Okay. Thanks so much.
But you know, we would be happy for people to use Spark tool and then share with us their experiences if they get the chance. I guess the key thing is not using the Spark tool, it's just having a structured process. What we will do after this presentation is share with you the slides, and hopefully they will be helpful to you.
Thanks so much. We've come to the end of the webinar. And thank you again, Ellie and Amina, for making yourselves available to present on this important topic. I hope people gained a lot of knowledge from it. I sure did. And just to remind everyone that the recording of the webinar will be available on our website, and we will email all participants with a copy of the presentation slides. So thank you, everyone. Thank you, Ellie and Amina.
Thank you.
Bye-bye.
Thanks.
Yeah, bye.
Thank you. Bye.
Thank you.